Recovering from knee surgery is highly variable.
It was going to take forever to get better if I was ever going to get better.
There's got to be something out there besides a CPM machine, which clearly isn't helping me.
Active and aggressive with this thing, or I was going to need
I'm a guy that's not looking to relieve the pain. I'm a guy that's looking to get back in the game.
That downtime was not what I wanted.
We've spent the last 7 years perfecting the recovery system that takes variability out of knee rehab, so you can quickly get back to your life.
Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
My name is PJ Ewing, and I am a recovery coach at X10 Therapy. I am in New York, although our company operates in a number of states. And we have a patient, a knee patient, Robert Douglas, with us, and the conversation today is really going to be about Robert's story, what was good, what was bad, what was difficult, what to look out for, just coming right from you, Robert, what your story is about your knee and how you ended up recovering. So I guess before I start prattling on any further, why don't I just give the floor to you, and maybe you can tell us a little bit about yourself and your background?
Sure. Again, my name's Robert Douglas. I grew up in Wichita Falls, Texas. Joined the Army National Guard at 18. My primary purpose for doing that was to help pay for college. And so right out of that, I went to nursing school. Met my wife at age 24. We got married and joined the Army right after that. Spent a little bit of time at Fort Carson, Colorado. Was stationed at assigned to the Combat Support Hospital. And then after that, we moved to Fort Worth in 93, and it's been our home ever since. We have 3 daughters that have all finished college. A couple of them still haven't left home yet, though. What I do for work, my career is basically I work for a skilled nursing and rehab company. And I basically write appeals for denied services by Medicare and insurance companies.
Interesting. Do you practice as a nurse at this point?
No, not really. The only thing I do for nursing is I read, the medical records and make a determination based on the regulations to see if I disagree with Medicare's decision to deny the skilled services. And if I do, then I'll, basically write an appeal letter, a position statement, and outline why I think it meets the regulations.
So the nursing plays a pretty important role in what you do, though, that your practical nursing experience from the past.
Practical nursing experience, and yeah, pretty much, because you have to think about all those things. And really, a lot of it is actually rehab, to be honest with you.
Really?
Yeah. So I've learned quite a bit about rehab just by doing appeals, because a lot of the claims that are denied are rehab claims.
And what is the more common cause for a rejection of a claim? Is there couple culprits?
Yeah. The number one culprit is patients not making progress. And they'll deny a claim and say, you kept this patient on an extra month, and during that entire month, they didn't make any progress at all. So that's probably the number one issue. But, there are other factors that might take the skills of a therapist other than them showing true, maybe they're needing to gain strength, or maybe they're starting to regress some, and they're trying to help them to stay where they're at least.
A lot of it's pretty numbers based, I would guess, in terms of progress.
Yeah, it very much is.
Well, we face that at X10, where we have workers' comp claims that come through, and the companies have never heard of X10, so we have to go through some hoops to validate that we do what we do, and then we do with the data that comes from our device, we end up being able to show progress, pretty concrete progress. But I'm getting ahead of ourselves. So So you're working with a lot of claims on a daily basis. Let's go talk a little bit then about your knee history, when the problems started, what you had to do about them. You ended up with a knee replacement and then complications. Do you want to tell us about that story a little bit?
Yeah, wow. I mean, it's a pretty interesting story. It's a tough story to even tell. I'm thinking about it, but I used to try to go back, maybe even, I don't know, 7-8 years ago. I wanted to start working out, so I started running, and I had, through the time I was running, I'd have multiple meniscus tears, and I would go in and have a scope to have them cleaned out. And in really where my trouble started with this was in September of 2016. I was playing flag football, and I ended up tearing my meniscus again, but I also tore the articular cartilage that lined the surface of my femur bone. And so I had a scope in January of 2017 to clean that out, but it really wasn't doing well. I had a lot of pain still, and I talked to my surgeon about it, and he's, just basically said, you're just going to have to live with it. So I went to another orthopedic surgeon and to get a second opinion, and he said, well, I basically agree with him, but we can give you a steroid injection if you want. And that was in February. So I said, sure, why not? Couldn't hurt. Well, exactly 24 hours after I got the steroid injection, my knee just got swollen and stiff, and I really didn't know what was going on. I thought it might have been a cortisone reaction at first, so I thought, well, I'll give it a couple of days and see what happens. This was Friday when it swelled up, and so I just waited throughout the weekend, and it never got better. I went into the emergency room on Monday. This was the 20th of February, 2017, and told them, look, something's going on with my knee. I told them I had a steroid injection. 24 hours later, it got stiff. And, and what's interesting, PJ, is I went in, I really didn't even present with any outward symptoms that you could tell I had a septic knee. Wow. And they were actually going to turn me away. My temperature was normal. My knee was not obviously swollen, maybe a little bit. It wasn't red. It wasn't hot to touch. And I said, something's wrong. I said, just, please do, get some testing going. So they did a CBC and an X-ray, and they did a CRP. And it was just a little bit elevated, and they came back to me and said, you just, it's a little bit elevated, your white blood count. Not really a lot, but the only way we're going to be able to tell is tap your knee. And so they did, and you could tell right away. They had a hard time pulling it out, actually. So I spent a week in the hospital. I had 2 surgeries back to back to clean out my knee. And then out of the hospital, I was at home on IV medications, and the therapist that came out basically told me there wasn't anything that he could do for me. So I was without therapy for 6 weeks, and finally went to outpatient rehab after I got off the IV antibiotics. And I was, the other thing about my knee is that the infection actually got into my femur, so I got osteomyelitis as well. So I was just left, my knee was shredded, all the soft tissue was gone, I was bone to bone, and I was just in a lot of pain. I could not walk. I had to buy a mobile wheelchair to get around. And after a septic knee, you have to wait so long to make sure it's totally eradicated before you can have a knee replacement. So the surgeon told me 12 months, but he said, if you're good in 8 months, we'll try to do it then. So in November of 2017, I had my initial TKR, a total knee replacement. And I had a tremendous amount of swelling. I actually went to a rehab hospital for the first week. And I just from the very beginning had a hard time really, gaining any range of motion. And, that really continued on after I got home and went to outpatient rehab. And what I can tell you is that, you can tell if you're not getting motion because of tight tissue, but there was some kind of mechanical block that was going on. And so I kept talking to my surgeon about it, kept talking to my therapist about it, and I really didn't get anywhere. I didn't, I just told them it won't go past that. It's something blocking it, and I could feel it whenever the therapist would press. I mean, they would muscle up on my leg pretty good, and it would just be excruciating pain, and it was like just bone pain. So I knew there was a mechanical block. So I finally went to. I was looking for options on the internet, and what could I do? And I saw the X10. I thought, well, that might have been helpful. I don't know. At the time, I kind of looked into it and thought really it would be good. And I think I actually talked to you during that time, but I needed to get something done about the mechanical block before I could do anything. So I was left at about 85 degrees flexion. I could walk, but it was very limited. I had a lot of pain still, just walking. So my walking was just around the house, more than anything. So I just, really deteriorated, and my flexion was about 85 degrees. So I'd have a hard time, getting up out of a chair or anything like that, or even sitting for very long would be tough. So I finally found a surgeon that was actually recommended to me by one of the therapists, and they said, check him out. And so I did. I got in with him, and he did a workup on me and looked at me and actually put his hands on me and tested me and said, you have a lot of instability in your knee. And he didn't really know about the mechanical block. He couldn't really comment on that, but he said you definitely need a revision. And so he said, but we need to give it some time and let your knee calm down. I don't know why he said that, but so the knee surgery, I had the knee surgery, the revision on October 3rd of this year. And so I basically, within 19 months, I think I counted, PJ, I had five separate knee surgeries within that time period. And, so for close to 2 years, I had a ton of scar tissue that had built up, was left with 85, 90 degrees flexion, and my muscles were severely atrophied. And so that was kind of my starting point on October 3rd when I had my revision done.
Let's pause there for a second then. First of all, my heart goes out to you. You did not expect this saga.
Yeah.
And that is really a journey with the 19 months and the 5 surgeries. I'm going back to some of the things that you said. Firstly, I'm interested in when you were in the rehab hospital, how long were you there, and what was the routine? What was the rehab program that you underwent when you had your first surgery?
Yeah, I was there for only a week after I got out of the hospital. The routine was they wanted you to come to therapy 3 times a day. And I think you could describe it as a pretty typical rehab for knees. So they would get you in and kind of get you warmed up with doing, a few exercises, get you on the bike a little bit, and then it would be, them working on, range of motion with you doing, active as much as you could, and then they would press. And try to get more, which honestly, I mean, I really didn't even understand this at the time, but I honestly believe that's part of the issue, is that, there are some therapists that just believe in being super aggressive and will, really try to press your knee beyond where it really needs to be going at the time. And so, that I think was a little bit of setback too.
We talk about that a lot in our company, and we're, I think, allowed to espouse the view that we don't believe in no pain, no gain. We have a device, this X10 machine, which we'll talk about, that allows you to recover without excessive pain. Not that you're not going to be in pain at all, but you're able to moderate the pain and control the pain more. And so we talk a lot about being able to get to your goals with patience, persistence, and the X10 machine. And we hear stories like this, which are, I was in PT and I was set back by overly aggressive PT. And I don't blame the physical therapist. I mean, there's a certain philosophy where, and they've seen it themselves firsthand, where if they don't get aggressive, they're just never going to get results. But that can be counterproductive. And we spent a lot of time studying and experiencing recoveries that never, the patient never really had to go as far as the PT does. Is that the view that you would agree with?
I would absolutely agree with that 100%. I know, even during this recovery, I mean, after really understanding that, I mean, you still, even personally, you want to make progress, you're driven, and, you have to have a certain amount of patience. And even for yourself and your own recovery method, you may want to take it a little bit further than what it should be taken, and you're going to regress. You're going to put yourself back a little bit, and it's hard not to do. But I think there is a fine line between getting to the point to where you're making progress a little bit at a time, and then overdoing it and ending up taking 2 or 3 steps backwards.
It's really hard to know where that line is too. That's the frustrating part. Even with a tool like the X10, you've got to listen to your knee. And I when I talk to patients about their recovery, it's take your brain, move it down into your knee, and look around. How does it feel? Keep visiting your knee mentally to see how you're doing, because you're whether you're using this device or you're just recovering on your own, you have to be super in tune with what's going on down there. It takes a lot of focus.
That is a great piece of advice.
Yeah, it's because it's kind of annoying. So how are you doing? How do you feel? you get asked that a lot. When you're doing recovery with a PT or with one of our coaches, it's and you have to really think about, well, I don't know, how do I feel? I gotta get in there and look around.
Yeah.
Okay, so this 19 months ends with October 3rd and a surgery, a total knee replacement revision. Do you want to mention your surgeon and talk about what you thought of him and how it worked out with your surgeon?
Yeah, absolutely. I mean, I ended up finding, it ended up being, I told you it was a referral from one of the therapists. And so I looked into him, and this particular surgeon, Robert Schmidt, he's part of a group that's all they do are knees and hips. And they don't get into a lot of other things. So they do that, and they have a hospital that is set up for only hips and knees. And so the whole experience for me was really a lot different than my first experience. I mean, they were very meticulous and very methodical about every step of the process. And they were, they really wanted you to be educated. And one thing I think that is important as well in your post-recovery is prehab and working, trying to work to gain some strength and that sort of thing just is really, really important. So they really pushed that. I had very little pain, and one of the differences is most of the, I don't know about most, but before I just had general anesthesia, woke up to an incredible amount of pain. had to have a lot of pain medication. They actually do a spinal, and then they put a catheter in your leg to do more of a local block every day that you're in the hospital. I didn't have to have that much pain medication. It was really quite amazing. The swelling was, when I looked at I was in a brace for the whole 2 days that I was in, 2 or 3 days I was in the hospital. But when they took the brace off, I looked at my knee. I was like, this is such a big difference from before to this revision. And I don't know if that just happens to be because, they're doing a little bit more drilling or whatever. But, they had to cut my bone again, too. So not sure about that. But I had a lot less swelling. I did virtually no bruising at all. So I'm super, super happy with, how that turned out. And I think
what was the name of the practice for Dr. Schmidt?
It's Texas Hip and Knees.
And what hospital was it?
It was, oh goodness, I don't remember.
I put you on the spot, huh?
Hospital. You did, a little bit. I think I might have to get back to you on that, but I think
Sure.
it's Texas Health, Surgical Center or something like that. I'll have to get back to you. But all they do are hip and knees at this hospital.
We'll put that in the show notes for this, so
yeah.
That's great. But it sounds like a real endorsement for that surgeon. I don't know of the surgeon other than through you, but that's in Fort Worth?
That's in Fort Worth, yeah.
Yeah, okay, Fort Worth, Texas. And then, so were you able to do much prehab?
I really didn't, I'll be honest with you, but I do think that it did limit me some. But I did walk as much as he wanted me to walk as part of my prehab. And I did walk more, but I didn't do probably as much as I should have.
Well, your knee was super compromised also, so it's not like it was easy to do.
Yeah.
You mentioned atrophy. How did that actually affect your life, that loss of muscle over those many months while you're waiting for this new surgery?
Well, I don't know. I really don't know. I think it contributed a lot to the instability of my knee. Other than that, I don't really know, because I was just in such a limited mobility that I really couldn't do a ton. The knee was very, and this is one thing that he told me, that also that my PCL was very deteriorated, and which caused some of the instability as well. And so he actually put a post. He took the PCL out and put a post. I don't know exactly how that works, but he put a post in the back part of the prosthesis to help provide some stability for my knee. So I really don't know. I think I feel more of the impact now, just because I feel the shortened quads, and trying to stretch, and I think my knee is getting to where it's getting looser, but my quads are still pretty tight, and it's hard to I feel it up in my quads quite a bit. So I think I'm going to notice it more on this side of things than I did before, just because I just wasn't using them.
Right. Yeah, I think that you're in for, I'm interested in, maybe we can talk again in 6 months, because it's going to be a strengthening recovery for you. There's going to be a lot of work there needed. And to
absolutely.
Feel like you're back to your normal self. I know I didn't ask earlier, and I'm sure people are curious. What is your age?
I'm 51.
51.
Yeah.
Yeah, it's young. For all this to happen, right in the middle of everything. It's a young age for all this.
Yeah, it is. It's tough.
But we are seeing more and more younger patients have total knee replacements for a variety of reasons. I'm sorry. Go ahead. You were going to say.
No, yeah, one of them is 51. Well, at the time is 49. I think 48, going on 49. I was playing flag football, which I shouldn't have been doing, but I think it just tells you. People are wanting to live a more active life now, and I think there's a real surge for that. And I ran, until I had multiple scopes, and then I got on a bicycle and rode just a road bike. and did that for exercise. I ended up loving the road. I didn't think I would going from running to a road bike, but I really enjoyed the road bike. And then I really missed it because, and I thought, you know, even if I could get, like, even on a recumbent bike, if I could get to where I could just rotate and ride that, you know, I could use that, but I could not turn over. I just couldn't turn over. I could go backwards in rotation, but it was very, very painful to do. So, I mean, I just gave up on it, to be honest with you.
It's one of the great recovery tools out there, the bike, stationary,
It really
recumbent, even actually riding a bike outside. I mean, it's an amazing activity. We recently published an article on that subject, and with our program, you know, we feel like it's the step after the X10 machine is in a home, and you're done with it. Then, you know, the hope is that you can transition to a bike and rotate and keep using that tool for months afterwards to maintain range of motion. There can be a little strengthening work if you do it right. High intensity training can really help, but the bike is just a great tool overall.
It really is. It really is.
Do you have a stationary bike then at home?
Yeah, I have I bought a recumbent bike. I have a spin bike that, you know, I was using kind of to train whenever it was, you know, the winter time. So I had that, but I just couldn't get up on there, and it was just a little bit too difficult. But so I bought a recumbent bike after my initial TKR. But like I said, I mean, I never could get to where I didn't just have a ton of pain riding. You know, I couldn't go forwards at all, even with that terminal extension with my, with my knees at terminal extension and even my toes kind of pointing forward. I could not go forward. I could go backwards a little bit, but it was just so painful. I just couldn't do it for any length of time at all.
And I think you mentioned range of motion was it in the 70s, 75?
Oh, it was, no, it was better than that. It was
85?
Like 85, yeah.
Yeah, which doesn't allow you to ride a bike, obviously. So
Yeah, no.
Okay, so good. We caught up a little bit. Thank you for all those answers. We're now at October 3rd, and you were in the hospital for a couple days, and then you went home. Is that what happened?
Yeah, that's right. So
okay.
Yeah, I went into the hospital Wednesday and came home Friday.
And there you are at home, and you have, I don't remember, was the X10 delivered beforehand, or did you get it when you got home?
Yeah, I got it on Saturday, so it was the next day, which was probably better or good for me, I guess, because, I mean, when I got out of the hospital, I don't think I was ready to work on anything right then. So, but the next morning it was delivered.
All right, so we've referred to this X10, but I think people are like, what, the who? Can you describe the X10? What is it in your own words?
Well, the X10 is simply, I think, a machine that helps you gain your range of motion. It's basically it's a chair that you sit in, and then there's a platform where you put your foot on the platform, and that has rollers above your ankles or at the bottom of your shin bone, and then behind your leg as well. And it just can passively take your leg through range of motion, through extension and through flexion. I hope that kind of described it pretty well. Sure.
Did you use it for strengthening at all, or was it really just for range of motion in your case?
Well, in my case, I thought about it, and actually, you know what, PJ, what actually happened is initially I thought, all I'm going to do is range of motion, because in my mind, I was thinking to myself, and I actually talked to Tricia, one of the recovery coaches for X10, about it as well, and she gave me some feedback and agreed with me. So I thought, I know my muscles are atrophied, but honestly, if I try to work out my muscles right now, it's going to cause additional swelling that's going to limit me in gaining that range of motion. So for me, my biggest focus was on getting that range of motion. And in fact, my I had home PT. The plan was to have home PT for 4 weeks. So they came on Tuesday, the following week after I got out of the hospital, and they, did the normal exercises, the quad sets, the heel slides, the leg raises, all of that stuff. And after I had done like 15 sets of each, so not a ton of work, but my leg just blew up. It just blew up, and it set me back. And I basically called the surgeon's office and told him, I just want to hold off on PT right now. So I held off on PT for close to 2 weeks, and I focused on my range of motion only. And I think that really helped me.
Wow. And what kind of progress did you see over those 2 weeks?
Well, the first day when I used it, I started out at probably 80 degrees. So, I was at around 85 going into surgery, and then I was in a brace for 2 days for the whole time I was in the hospital. So I came out, I was pretty stiff. So I started at about 80 on the machine, and I would say within the first week, I know within the first week I was at 100.
That's a lot of progress.
And
we talk about 2 to 3 degrees a day, and I guess if I added it up, it probably matches that a little bit. The gains get harder as you go further, right? But at the beginning, that's a lot.
Yeah, and that 105 mark, I'll be honest, that's when I kind of hit a wall, and when I hit that, and one of the things about the X10 that the coaches really reinforced is just to really listen to your knee, take it easy, take it slow. Maybe if you can get 1 degree a time, at each session, that would be great. But listen to your body, and of course, this is what I was talking about earlier. You're excited and you're feeling good, and so I hit 103 and I was feeling great, and so I thought, well, I'm going to go. And I was feeling good. I was on the machine. I got to 103. I was feeling good. I was like, what? I think I can get that extra degree. And so I did that, worked it a little bit. And I thought, what? I think I can get that 105. And I did that. So I got 2 degrees at that one time, and my knee blew up. And it really set me back. So I think that's, an important thing, and just making sure that you just take things really easy. You may be feeling good, but you got to really listen to it. And you're right, there's such a fine line. So it set me back for maybe a day, but what I found was if I just take it easy, so I backed off for the next day. I just backed off, and I think I thought, well, if I could get back to that 103 at least. And so I did that basically for the 2 or 3 sessions that I did that day, and didn't try to push it, and made sure I rested a lot. And then the next day, okay, now I'm back at the 100, I'm back at the 105 and can kind of start to move forward. But yeah, you got to remember that I'm starting at 85, so I'm starting to tear into that old scar tissue at this point, and the deeper I go, the more that I'm really breaking up that old scar tissue that was there. My surgeon told me right out of surgery, he said, we did cut out some scar tissue, but he said, you have a lot of scar tissue. So he told me, he really felt like I'd get back to where I was pretty quickly. He said, but you could expect to get to 105 maybe max in 3 to 5 months. He said, I'd like for you to be able to clear stairs easily, walk up and down stairs, but be able to walk and that sort of thing for exercise. But so that's where he was hoping I would be at 3 to 6 months.
Wow. Well, yeah. And I if I can go into the brain of the surgeon, which I'm not qualified to do, everybody, but I can pretend, right? And I can imagine that he's thinking about all of these procedures that you've had in that knee for years and years, the injury, but the things that happen all along the way, and that just every one of those invasive surgeries causes more growth in there, and it becomes gnarly, if you will. So
Yeah, absolutely.
I'm sure that's what
And
he was thinking.
Yeah, and he saw it, you know. I mean, it's not even just thinking about it, right? I mean, he like looked at it and out of surgery was like, you have a lot of scar tissue. So he was, you know, he said we did get some of it out, but there was just a ton in there. And so, you know, 105, you know, would be good. And I was thinking in my mind, well, that just doesn't sound promising. I mean, it was good. And I thought, well, you know, if I can get to 105 and can walk without pain, I mean, you know what? That's great. I mean, I can live with that. And even at 105, I mean, I might have to, you know, push the seat back a little bit to ride a bike, but I could ride a recumbent bike maybe for some exercises. So that was, you know, that was okay. I could live with that. I was hoping maybe closer to 110, but 105 would have been for me after all I've been through.
So you did that 105 in, did you say within a week or 10 days?
It was about a week. Yeah.
About a week. What happened after that?
Well, what happened after that is, like I said, I really hit a wall. And, you know, what I would really focus on every day is to not give up what I gained. At least don't do that. He told me I'd be at 105. Here I am at 105. So if I don't give that up, you know, I've met his goal at least. And so I would focus on that, and lo and behold, after working it for a day and then the next day, you know, just trying to take it easy, you know, I'd feel a little bit looser. And I'm like, you know what? I think I can make 106. And so I'd give it a shot, and sure enough, there's 106. You know, I'd be a little bit tight, but I'd work that. And so, you know, periodically, you know, I would go with 106 one day and maybe get 107 the next day. And then, you know, here I am again, and we have short memories, I think, because we're so driven and we want to make that progress. And so, you know, here I go again. So I'm at 107. So I'm thinking, you know what, it's feeling pretty good today. Let's go from 107 to 110 in one setting. And so there I go. I'm kind of regressing again. So I'd have to give it a day or two, you know, that sort of thing, and let it calm down and get back to, you know, but I would just, like I said, kind of stay focused on, well, let me get back to where I was at least, let it calm down, and then see if we can make progress. And so little by little, you know, I was able to get it back. I will say, though, from 110, and I'll just go ahead and tell you, I mean, I maxed out at 123 degrees, but from 110 to 123, it's still pretty tight. I usually will warm it up with the bike a little bit first, maybe for 5 minutes. Oh, and you know, I know you're probably going to get into this, but I can ride a bike now, and so, you know, I'll warm it up on the bike for maybe 5 minutes, and I'll get on, and I can start at, you know, 110 to 115, kind of depending on the time of the day. Early mornings, it's going to be a little bit stiffer, but I'll start out at 110, 115, something like that, and, you know, just slowly work it back through the, but it's still pretty stiff from probably, you know, probably 110, 115 to that 123. But I think the thing for me that I know is that it can get there, and if they keep working it and keep, you know, just slowly, I think it's already broken there. It's already gotten to that place. And so I know that over time, if I just keep working, keep riding that bike, keep moving the seat up, you know, I feel like that I'm going to end up in a very good place. So if I end up even at, say, 115, that's 10 degrees over, I can ride a bike very easily. I think coming from 85 degrees to 115 degrees is tremendous progress, and more than what I had anticipated, and certainly more than my surgeon anticipated.
Yeah, you know, the surgeon's opinion carries such weight. And I've seen this happen in a number of cases, more than a lot of cases, where the surgeon has said, well, I don't know, we could only get you to 105, and on the X10 we end up at a much larger number. and it's always exciting to think that we can,
Yeah, it is.
you know. But it's not just this device. The device is a machine. It's a tool. You've got a coach. Okay, good. It's you, Robert.
Mhm.
It's everyone who's listening to this can hear your dedication. You threw yourself at this. After 19 months, you are not going to let this thing get you. And this is a testament to your work ethic, getting your knee back. I mean, I love this machine. I love what it does. Coaching is great, and you know, it allows you to, you know, find those lines and work those angles very, very carefully and try not to overdo it. But it's you thinking this through so well, and so I just, my hat is off to you on this.
Well, you know, PJ, I mean, I'll be very honest with you. I mean, for nearly 2 years, I lived in a very dark place, you know. I mean, you go from playing flag football to barely being able to get around the house. A year of that in a mobile scooter. Another year, you know, just enough to make it to the kitchen and get a cup of coffee. And, you know, with I looked at the X10. Like I said, I talked to you even back in January before I even met the new surgeon. I didn't know what was going to happen, but, you know, you look at it, and I would encourage people out there, if you don't know what the X10 is, look it up and read about it, research about it, because what it gave me was hope. And without that hope, I couldn't have done what I've done. And so the surgeon was a big part of that, and the X10 was a big part of that. So I had hope. It really is what drove me. But I will say too, even during the time, there's, for people out there that have gone through, you know, multiple surgeries, and you're wondering, you know, if things can be possible. I think they can, but I think even during the time where you're thinking, okay, I'm getting a reset, I have this great machine, there are still going to be dark days, and you have to keep pressing in. And, you know, I kind of laughed about, you know, getting to, you know, like I went from 103 to 105, you know, and my knee blew up. Well, you know, I didn't know, was that going to be the end? You know, was that it? Would I make any more progress? So there's still going to be dark days in between while you're making progress, and it's slow and it's tedious. But I think it's important that you do, like you said, listen to your body. Don't push it too far, and don't give up.
I just have to tell you, Robert, we make, you know, marketing materials. We do lots of interviews, and we show the recovery stories and their happy occasions, and they're wonderful. And you know, almost all of our patients just, you know, nail it one way or the other. But what they don't hear is what you just said, and that is that there are dark days, and you got to get through those, and don't give up faith, lose hope. And I've got patients right now who are in that sticky spot, that 103 to 105, and then they just can't get past it, and they're concerned, and, you know, and your words are so important because they all get there, but, you know, it's very emotional. It's a very emotional journey.
Okay.
You really do think, shoot, doctor said 105, you know, and there you were saying, shoot, I guess that's it. I mean, do I even dare think about 106? And
Right.
You decided to think about it, and you started to feel 106, and lo and behold, as you said, 106. And that was a few weeks ago, 2 or 3. I mean, we're about almost 5 weeks post-surgery. I guess we are right about
A little bit over.
5 weeks,
yeah.
4 to 5, right?
Yeah, 5 weeks.
Right. So this wasn't that long ago. This happened to you, but yet you had the confidence in your coach and the machine and yourself. And, you know, you've sort of, in a lot of ways, proven the surgeon wrong, and which is wonderful in this
right.
case.
And I think for me too, PJ, Tricia, my recovery coach, and I think she really played a big role in, and I think this is where the recovery coach really came, for me personally. I think this is what Tricia did for me. is because I was thinking, maybe if I could get to 110 after another week of this, and, she would tell me stories about, other people getting, more. And, because I was kind of like ready to give up a little bit and ready to kind of consign myself to that 105. Maybe if I could get to 110, that'd be great. And so, she didn't push me. She didn't want me to go further than what I could, but she wanted to make sure I knew where that window, where I knew where that stopping point was. And she did a great job of balancing that with take it easy, make sure there's a great balance between rest and pushing yourself, but make sure you know where your true wall is.
Wow. I think there's a community that we build with our tools, our Facebook, our email series, the coaching. But I see patients helping patients with increasing frequency. I see them helping each other in our private chat groups, and there have been phone calls from patients to help other patients. And what you're doing with this podcast, this recording, which is all brand new to us, but is incredibly beneficial for so many people. I'm anxious for lots of people to hear this, particularly those who are maybe going through a tough recovery after the fact, or just don't know where to turn. I mean, there's hope, as you say.
Yeah, absolutely. And I had after the initial TKR, I really did just give up. I didn't give up, but I did in a way. Honestly, I mean, I prayed, and I know a lot of your listeners may not pray or believe in that, and that's fine. But for me, I do. And so I prayed and asked God for help. And I believe he did two things for me. Number one, he gave me a great surgeon. And number two, he led me to this because PJ Atkins, and I know you say this is not a commercial, this is not anything like that, but I don't know how I would have made this progress without the X10. And I think part of the reason why is because I think it's the design of the machine. I think one of the things is sitting and getting that range of motion in a sitting position is really the best versus maybe lying on your stomach and then pushing your leg up. So I think that the whole design of it. But I think the other thing too is that the range of motion that you get is very, very controlled, and it's very, very precise. It's not any more than you need it to be. And when you're with a therapist, unless you really tell them, they don't know where that real stopping point is if you're in a ton of pain, and so they're just going to keep pressing until maybe you come screaming off the table. With this, you can make that little and you can make those very incremental, decisive changes in how far you go back. It's very precise. And so I think that's a big reason why the X10 for me, I think, was really helped me through my recovery because it was so precise.
That's wonderful to hear. And I really appreciate your comments about that. And as you said, we're not trying to make commercials here. We're trying to help people with or without this X10 machine. There's a lot of needs, a lot of different conditions. And, this is a tool, a solution for many. This has been really great. Is there anything else that you would want to pass it on, pay forward, whatever, to future knee patients? You've said so much, but I want to leave an open end here for you to share any other nuggets that you've got.
Yeah, I think that all we have talked about a lot, and I think all the points I wanted to make. But I think if there's any one thing, it all starts with your surgeon. Make sure you get a good surgeon. That's it, really, PJ. Thank you for the time. I appreciate it.
Oh, this has been so great. Thank you for your time. And you've still got the X10 for a few more days, I know. So
yeah,
keep rocking with that thing.
I am.
And what is your plan when the machine's gone?
Well, I'm in outpatient surgery right now, and actually, the one thing we didn't talk about. So now I'm actually able to start building my strength, and I'm with a great therapist now that's still taking it easy with my joint, but we are starting to work on muscle strengthening, and so I think, and one of the things I think I told you, I was like, it's still kind of stiff from that maybe 110 to 115 to that 123. So I think there is a device out there that I'm gonna use maybe to try to help me maintain that at least. And so I'm going to use that. We talked about it. But I think the biggest thing for me is really the bike. I think you said that. And I think just keep moving up. So I've kind of gone up several notches on the machine, on the bike. And so I think just keep moving up, just if nothing else, just to maintain that range of motion.
I'd like
to be a big part of that.
I'd like to catch up with you in 6 months. Maybe we can do another conversation like this, and just to see how things have gone, because you're not done. It's been 4.5, 5 weeks, so there's a lot more in your future to continue your recovery. I have all the confidence in the world that you're going to get there, but I think a lot of people might want to know how you did, to maintain it and put this really in your past.
Yeah, exactly. I'd love to do it. I am definitely committed to it in the process, and like I said, I think for me the biggest thing now is like I feel like I've kind of gotten that range of motion. I need to maintain it. I know I need to do that, but now I can start on that muscle, or gaining strength. Excuse me. But I'd be glad to catch up with you. And I hope in 6 months I can tell you, hey, I have full range of motion.
Right. Well, that's another journey for you, and it will take months. But I think everybody listening is believing in you, and we'll be excited to hear a report. Let's do it maybe February, March. Let's see how you're doing when we get to that point. Maybe April.
That sounds good.
All right. Well, thank you again. This has been just amazing, Robert.
Yeah, for me too. So I appreciate the time.
I'm Dr. Justin Trosclair, host of 2-time Podcast Awards nominated A Doctor's Perspective podcast. I interview doctors in and out of my profession about their specialties and the occasional non-doctor special guests. But we also go behind the curtain and see what's working for their marketing, overcoming struggles, practical knowledge, book choices, and relationship advice. Join me on any podcast app on your phone or visit adoctorsperspective.net for the show notes pages and free resources. I want you to have an abundant home life as well as a thriving practice. So come on, take a listen.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.